United States Patriot Nurse, and today the subject that we are going to talk about is really in the form of a question, which is, what kills pregnant moms in a poop-it's-the-fan scenario? So, in order to answer this, I'm going to take you on a journey, and we're going to find out what are the top 3 causes of maternal mortality, which is what kills women when they have babies. What are the top 3 causes of maternal mortality, and what can we do about it? So please stay with me. This is very important. This is one of the most important videos I have done, because the information that I'm going to give you today could potentially save a woman's life. Even if you don't know anybody who's pregnant right now, guys, especially you guys, don't zone out on me. You need to pay attention to this, because this could save a woman's life. So let's ask ourselves, okay, if in the United States, let's just take a sample right now of what the United States looks like, okay, compared to 100 years ago, as far as our base level familiarity as a people with the birth process and what happens. 100 years ago, if somebody were to have a baby at home, well, a lot of people did have babies at home. And most women had a familiarity with, okay, this is what happens and this is what you do. We do not have that anymore as a country. This is a ticking time bomb on our hands. If something were to happen on a very broad scale in a collapse scenario, you would have, think of all the little pregnant ladies right now who are planning on going to the hospital, and that may or may not be an option for them. So this is something you need to pay attention to. What are the things right now, according to the World Health Organization, that what are the reasons that most women who die from birth, what are the reasons that they die? The first is postpartum hemorrhage, bleeding out too much after they have a baby. The second is sepsis, acquired infection that goes systemic to the mom, takes over her body. And the third is pregnancy-induced hypertension, which has a whole different smattering of manifestations, but pregnancy-induced hypertension. So let's talk about these things and what you do about them. This is a crash course, by the way. This is the briefest of summaries, and it is not intended to be an exhaustive approach to this, but it's going to give you a base level familiarity with what to do. Postpartum hemorrhage officially means that the woman has lost more than 500 cc's or greater of blood after she has the baby. Now, at first glance, if you've never been in a birth before, the blood that comes out afterwards, it looks like a lot, but keep in mind that when a woman is pregnant, her blood volume increases anywhere between 40 and 50%. So she does have some cushion that she can lose as far as blood loss goes. But postpartum hemorrhage, I'm going to give you a link, by the way, in the description box. Actually, I think I'll give you a link here. I'll give you a link right here so you can watch this video. Very important on how to deal with postpartum hemorrhage. But if a woman loses too much blood, then it's kind of like what happens when you bleed out from a gunshot wound. It goes into shock and a bunch of other things. So what are the things you do here? Well, I'm going to give you a couple here. When the baby is born, provided the kid, is not in immediate need of resuscitation, put the baby up on the mom's chest, okay? Very frequently, especially if the kid mom has not been under anesthesia, baby won't be sluggish, and very frequently they will want to nurse. They will want to nurse after birth. Not all the time, but frequently. This action of nursing releases oxytocin. This is the same thing as pitocin, except it occurs, naturally in the body. It's the same chemical. The presence of the baby at the breast, not even breastfeeding, but just the baby being present at the breast, this will also stimulate oxytocin, which will help the uterus clamp down, okay, and help control bleeding. Will also help the placenta come out too. So practice this. That should be the first thing. The baby comes out, put the baby up on the mom's chest, stimulate, drive the baby, check and see if there's need for intervention. Now, after the placenta comes, okay, when the placenta comes, you need to be compressing the uterus here, okay? You're going to be mashing down, and it's not just you're compressing it pretty good. You're going to be compressing the uterus here, and what that's doing is it's helping clots come out, and it's helping the uterus clamp down by massaging it that way. So, and you're going to be diligent to be massaging that uterus and making sure that it stays firm throughout the postpartum phase. So, this right here, these 2 things that I have given you, they will help you prevent postpartum hemorrhage. I have been in on some nasty ones, on some really decent hemorrhages, and it's scary, let me tell you. It is pretty scary. So the video that I have given you, for those who are interested in more in-depth analysis, the video that I have given you will go into detail regarding other measures that you can take. So there you have it. Now, the second leading cause of maternal mortality is sepsis. Now, this is acquired infection that the mom gets throughout the birth process. And there are steps that we can take to prevent this. The first here is, don't be handling the birth area with dirty hands, folks. This seems kind of duh, but it wasn't until quite recently that we realized, hey, we really need to stay clean, okay? So if you don't have access to sterile gloves, try and wash your hands as best as you can. I'm talking scrubbing really long, like saying your ABCs like 10 times. Like that, slow. But scrub your hands really, really good. And if you've got clean gloves, then put them on. But you need to stay as clean as you possibly can so that you don't introduce infection into the mom. Also, make sure, if you can, that the area in which the birth is happening, make sure that that's clean too. Okay? If we can avoid it, we don't want to be having the birth in a garbage dump. Just try and put down a clean towel under her. Also, that putting a towel under her will help you estimate this is how much blood she's lost, and it'll help keep it contained too. So keep the birth area clean. And I don't anticipate that you're going to be doing a lot of this, but try and keep your hands out of the birth canal if you possibly can. So we've talked about sepsis. Now the third leading cause of maternal mortality is pregnancy-induced hypertension. Realistically, we still do not know. We still do not have a really good idea of what it is exactly that causes pregnancy-induced hypertension. So just do the best that you can. Eat well, live a healthy lifestyle, and try and eliminate risk factors like having multiple partners. If you find yourself that you've contracted pregnancy-induced hypertension, or that it's come to you when you're pregnant, try and bed rest, limit your activity as best as you can, take it easy, and just try and chillax. So today we've talked about the big three that kill moms. So hopefully you can take this information that I've given you today and put it to good use. Hopefully you'll never need it, but if you do, you've got it there. So let me put forth a resource to you here, Spiritual Midwifery by Ina May Gaskin. If you can't get any other book, I would get this one. It's not exhaustive, but it's my favorite, and it will cover a lot of things. So hope it's been helpful for you today, and for now it's Patriot Nurse signing off. See y'all later. Bye.